Okay, I'll press recording again. All right. Okay, we'll just start again. We've got a lot, most of this stuff you guys know, and then everybody else will come online by the time we get to what I want to do. These are the relocation tests. This is the common pathologies. We have a rotator cuff disorder, bicipital tendonitis, AC joint sprain, and frozen shoulder. So they're the four common pathologies which you'll find, and they're probably the ones you need to know the most. Okay. So rotator cuff disorder, this is just the muscles that are involved in that, supraspinatus, infraspinatus, teres minor, subscapularis, and they all insert to the head of the humerus. And that's why I said that when we look at that insertion there, it's very difficult to ascertain which one's which, but the teres minor is at the lower border, and that's the one that you'll probably find the most pain. This is a rotator cuff background. The most common source of shoulder problems. It comes from a mild strain causing impingement. The diagnosis: pain in the lateral arm, trigger points, worse for active adduction. Limited range of motion, Apley's crash test. Impingement signs, Hawken test, Mears test. Tenderness, insertion of the greater tuberosity, painful arch. And these are the trigger points. So these are what they call Usher points. So this is a chart that you'll find most effective when you're looking for pain in specific areas. So when you have a client who has an injury, you're going to palpate the specific areas related to the disorder they're suffering. As you can see here, these are the 3 points that most probably I use needles for to help with those trigger points. That's another common disorder is bicipital tendonitis, and that's the inflammation of the insertion point of the tendon. And this is the long head it comes over, and that's where the tendonitis will be. That's the short head. And if there's a rupture there, it's very difficult to figure it out. Most physios can't even feel a rupture there. So it's the long head is the one that most people will feel, because when they're feeling the insertion point, they're feeling the long head, not the short head. And most of the time, you'll need a special test for that. So it's inflammation. Is everybody else online? Everybody else is there. Good, everybody else is online. Okay. Is everybody else online? Can you all hear me?
Yeah, I can hear you.
Good.
Yeah,
Okay.
good.
Excellent. So the diagnosis for bicipital tendonitis is pain in the anterior arm, AC joint, worse for bifid contraction, worse for resisted adduction flexion, tenderness over the tendon and bicipital groove, and the speech test is the one that's going to diagnose that. Okay. So there's some other areas that you can look at as far as when we look at bicipital tendonitis. The acupuncture points that you'll probably be looking at to help with that issue is, let me just find that for a moment. So for the tendonitis, the muscles that most probably will help to relieve that is the acupuncture for the pectoralis minor and those areas there, the deltoid, pectoralis major. They're all areas that you'll be looking for to assist with relieving pain for the tendonitis. The particular acupuncture points that you most help you will be stomach 14, which is a great point to help you with that process. Large intestine 15, which will help with the deltoid. Pectoralis major stomach 16, that will release the pectoralis. And of course, large intestine 11, which will help with that process. And anything else that might be good for you? No, they're all the ones. Rest.
Large intestine 12, no?
Large intestine 12, yeah, it's okay. That's directly into the muscle. Yeah, that can be. It's not a one we use very much, but yeah, that will go. That's you can use it as a local point. Yep. So the AC joint sprain is where the acromion and the clavicle and all the ligaments that are supporting that, one of them is no longer holding its integrity. So then you got to look for, okay, which one is it? Okay, so these are the particular ligaments that you're looking for the AC sprain. But as an acupuncturist, you're only looking at relieving pain and inflammation. The most of the times when a client comes to see you as an acupuncturist, they'll already have a diagnosis. As far as an acupuncturist is concerned, you just need to be able to say, okay, that's an AC joint sprain. Through my testing, I've identified the possible muscle groups of these. This is the acupuncture points that I'm going to use for the treatment. And this is the ashi points that I've gone here in the previous picture. These are the ashi points that I've identified, which are associated where the pain referral is, and that's where my acupuncture is going to go. So you're going to have 2 or 3 needles in the ashi points, 2 or 3 needles in the distal points to be able to encourage the qi and blood flow and to support the liver. Basically, that's all you'll be doing as an acupuncturist. So we've done that. And now this is the sprain. So these are the particular ligaments involved in a sprain. As you can see, they're very difficult to palpate and very difficult to find. The only thing is you've got localized pain, that's tenderness over the AC joint, limited range of motion. Is there any trauma or history? So that's a history of trauma, and that's as far as you can go. You perform the tests, the AC joint test, which is where we're pushing the elbow across the client to find out where the pain is. And as you can see, the therapist is standing to the side and just gently putting pressure across to see the stability of the AC joint. Frozen shoulder, again, it's inflammation of the glenohumeral joint. It restricts movement, there's pain, and it's the onset is gradual. So it takes from an acute stage of 3 months. If the pain is still in the glenohumeral joint after 3 months, and then there's limited range of motion, and there's pain in the painful arch and inability to complete the painful arch, then that's the beginning of a frozen shoulder. ACC will not cover frozen shoulders. So the therapists are very careful in writing up the initial consultation to stay away from frozen shoulder, because ACC will say, well, that's an old injury and it's a long-standing injury, and possibly you won't cover that. So as you can see, this is the age bracket that most people have a frozen shoulder, between 40 and 65. I don't think that's correct. I think I know lots of people under 40 who have frozen shoulder. Diabetes or diabetics have a strong lots of diabetics have frozen shoulder because of the sugar and the inflammation associated with diabetes. And then there's previous trauma. So basically, the frozen shoulder comes from instability caused by injury. And most of the time, it's a contusion. So we've fallen on the shoulder, we have had the injury, we didn't address it, and it's turned into a frozen shoulder. This is the phase, painful phase, stiffness phase, resolving phase. As you can see, 6 to 12 months to resolve a frozen shoulder. It's not a quick fix. The ACC suggests it takes up to 2 years to resolve. Now, that is how long a physiotherapist got to treat a frozen shoulder. Acupuncturists only have 12 weeks to resolve the pain. That's our only function. So as you can see, frozen shoulder, severe restriction of the movement. As you can see that the clients are going to bend sideways to be able to lift that arm up with this pain. So this is the referred pain. We all know what that is. As you can see, the referred pain could be anywhere. The buttocks, because of the trapezius coming down into the buttocks, the trapezius comes across and it comes down all the way down there into almost T12, lumbar 1. And that's why sometimes the buttocks are involved in shoulder pain. Also, this band of muscles that comes down from the neck to the hip also connects the head to the hip. And that's why there's referral pain. As you can see, this green area is liver. The liver is responsible for chi and blood. And so when there's an inflammation, when there's a poor flow of chi and blood, the liver is involved. And that's why liver can have pain. So referred pain is a problem that exists somewhere else in the body other than where you feel the pain. All right, so there's the objective assessment practice, which is what we did before. All right. So that covers all that. So this is musculoskeletal treatments of ACC guidelines, formulating a treatment. This is pertaining to the shoulder. So you need to know the aim of the TCM treatment to help restore balance and harmony between a person and their environment. Re-establish a healthy flow of qi and blood in the Jing Luo. You know where the Jing Luo is? That is the fine network of qi and blood between the skin and the muscles. Your choice of treatment, your diagnosis, and reflects your understanding of TCV theory. Have an idea of the limits of professional competence. If your understanding of the disorder is insufficient to form a basis of a treatment, then seek further information, X-ray, pathology test. If a problem is too severe or lies too far away from your field of expertise, refer. Always refer. Formulating a treatment, to treat or not to treat. All too often, patients present having tried to manipulate treatments without success. Referral back into the system is less appropriate. It is worth using your knowledge of TCM to try a different approach. This is why most people come to see an acupuncturist, because physios, chiros, and medical practitioners are not as effective as they should be. In most cases, if a patient has not responded at all within 3 to 4 treatments, then it's time to consider referral. That is also incorrect. We're allowed 12 treatments. 10 treatments is basically, I feel, is enough to be able to treat a disorder. If you have a problem, then refer. Okay. General plan of action, the circulation of qi and blood in the Jing Luo only. This is ACC. No need to disturb the Zhang Fu. That's quite incorrect, because to increase the flow of qi and blood, you need to support the Zhang Fu. Symptoms can be addressed directly and immediately using Ashi and local points. That's also incorrect, but they would like to see Ashi points, but also it's important that you support the Jing Luo. Local qi and blood deficiency from previous injuries that may require deep massage, moxa, or increased circulation of qi and blood. Muscle weakness is often important and requires an exercise program. poor exercise habits or poor warming or too little exercise requires some advice or retaining. So this is a general plan of action. This is what you're going to be suggesting to your clients to help resolve the issue. A general plan of action. So when you write your treatment notes, this has to be there somewhere. A general plan of action. You need to be, so this is all of a sudden they're contradicting themselves, right? You can't disturb the zone 4, but here we are disturbing the zone 4. External conditions with internal complications. Whereas more chronic or complicated problem is more important that you treat both levels. So internal treatments will usually be directed at spleen, liver, or kidney. Distal points and herbs become more important. And this is a general plan of action. Okay, distal points with herbal treatments are more important than local points. See, they're contradicting themselves. Holistic approach, lifestyle changes, specific treatment techniques. It is the patient strong enough to handle reducing techniques. So with the reducing techniques, what are we doing? We're accessing the reservoir qi and blood in the body, and we're using that reservoir to help boost or support the zone 4 or the flow of qi and blood. If the client is old and feeble or weak, or has a heart condition, or is on blood medication, or has underlying conditions, then you may have to consider that strong reducing techniques might not be enough. Might be too much, okay?
Can you give an example?
Okay, so if we, so I want to reduce the pain anywhere in the body, let's say the shoulder, right? And I use specific traditional pain-reducing points, which be Hegu and Tai Chong, right? So basically what we're doing is we're free coursing qi and blood, and then we might use a couple of points, Jing Law points to reduce the inflammation. And then we might put a couple of points to support that in the legs. And then to do that, I need to be able to access one of the 8 extraordinary points for qi and blood, which traditionally, to increase the flow of blood in the joint, you'll be using points like kidney 6 and small intestine 3, right, whole sheet. They're extraordinary points, and they increase the flow of blood and qi to be able to reduce the inflammation, which is a repletion condition, right? Or if we have a blockage of qi and blood, which the qi and blood can't go in, that's a deficiency condition. Now we need to be able to increase the qi and blood to be able to move that. If the client is old and they're already weak, so therefore they wake up in the morning and they're tired, they feel sleepy after meals, they don't do a lot of exercise, then for me to be able to do that particular treatment, I'm taxing their qi and blood too much. So possibly I will not use the 8 extraordinary whole qi or small intestine 3 and kidney 6. I won't do that. I'll probably just use Zosanli, stomach 36. Okay, because that's just a gentle overall conditioning point for the yin and the yang that will support my treatment, and that will support my ability to move the qi and blood. You understand that?
Yes, thank you. That was helpful.
So you just got to be, so with the distal points, which are quite strong. So distal points are around the joints of the wrist and elbows and fingers, and they're also connected to the 5 phase points. Sometimes they're too strong for the clients. Okay, or even a reducing technique. Oh no, that's fine. So you need to have a specific treatment plan, select the specific modalities, and that reflect your area of expertise, and also take into account the nature and location of dysfunction. Select the particular needling that you're going to use, body, ear, or scalp. I don't think most people will be doing scalp acupuncture. Some of you may know ear acupuncture. If you're going to use ear acupuncture, just use the pressed needles or very small needles, and make sure you disinfect twice. There's no blood flow in the ear, so if it gets infected, it's very difficult to treat. Be very specific in where you want to put the needles and how deep, and what the effect that you're going to have from the needle. Why are you using that needle? And then with the moxibustion, why would you use moxibustion? It has a penetrating and warming effect. It eliminates cold and damp, but moxibustion is contraindicated for people with yin deficiency. So if people are generally hot, they are hot at nighttime when they sleep, they sweat, or women are in a menopause aspect, part of their life, menopausal part of their life, and they're having difficulty dealing with heat, sometimes moxibustion is too much for them. A heat lamp is far effective, or cupping is just as effective. Cupping large muscle groups disperses chi stagnation and blood stasis, resolves dampness, and there you go. Moving cupping is a great way of resolving any issues on the back. Fixed cupping on everywhere else. Plum blossom needling. It's the little gadget with 7 needles on it, and you just gently tap on the joints and the soft tissue. It's great for bringing chi and blood to the area to resolve any inflammation and any dampness. Hot pack.
Henri,
Yeah.
do you have an example of what a plum blossom needle looks like?
All right. Oh, okay. I'll just go and get one for you. Just give me
Thank
a
you.
second.
Do you use it much?
Yeah, I use it, but yeah, a lot of people. It's sometimes it's quite stimulating, and a lot of clients find that quite
Painful?
painful. Yeah. Let me just share
No.
the screen here for you. Yeah, they don't like it as much. There we go. Can you see that? Can you see that?
Yeah.
So that's what a plum blossom needle. It's just got 7 needles. The shaft is quite flexible, and you just gently hammer the client. It's quite stimulating. Some clients like it. It's very good for facial palsy. Somebody has Bell's palsy, and the muscles on the left side of the face are a little bit inflexible and not moving, not smiling, not lifting eyebrows. Plum blossom around that area once a week or twice a week will bring the blood flow back in the area and help resolve it. It's quite effective. Okay. Where are we? Where are we? Where are we? Oh, lost. It's there. No. I'll have to stop sharing and do it again. Okay. So share, where are we? I can't find anything. Where was it?
Sorry.
No, I can't see where I was. No, that's not it. That's not it. That's not it. Okay. Let me just figure out where everything is. Just give me, you won't be able to see what I'm doing, so that's okay. Oh, that's why, because it's shut down. All right. Let me just turn that off. That one off. That one off. That one off. We're looking at that. That one's off. And that one's off. Okay. Okay, back now. Okay, lovely. Okay, I had too many windows open. Couldn't figure out which one it was. All right. So the hot pack, ice pack are great for stimulating the joint. I have an issue with the ice pack. Ice is not referred anymore because what ice does, it congeals and it stops the flow of qi and blood because it's congealing. It's restricting, right? So that everybody's moving away from the ice packs. This goes to show you how old this stuff is. Ashi points. So Ashi points or tender trigger points that do not belong to the primary channel and extend extraordinary vessel points and have a local effect. So when you are diagnosing a shoulder injury, or any injury, because this is pertaining to all of them, you need to find what channel the injury is on or what channel it reflects. For example, if we go back to the shoulder, you know that there is large intestine, small intestine, stomach, lung, sanja, and bladder, and to a certain extent gallbladder, right? There are lots of channels that are running through the shoulder. So when you know where the general area of that channel is, you'll know if it's reflecting that channel. The distal points that you'll be looking to considering is primarily yuan source and wall connecting points, and C cleft points, which are great. If you're on the back shu, we talked about that, or front move points. Empirical points. Empirical points means that they don't know why it works, but it does. For example, Tiako, stomach 39, I think it is, which is an empirical point for the shoulder. They don't know why it works, but it works. So study has shown in the past that this is a very effective point for the shoulder, and that's a point you can use. That's what that means. C-cleft points are great because C-cleft will help.
Sorry, the one you were talking is stomach 38.
Thank you, stomach 38. My apologies. I know the names, but I don't know the numbers. So yeah, so please feel free to correct me. Thank you. And it's an empirical point. Why does it work? Nobody knows. So if it's, we talked about if it's acute, it goes on the same side. If it's chronic, it goes on the opposite side. And you'll need to stimulate it. A lot of the old-fashioned practitioners, Chinese practitioners, will put tiako in while the client is, for a shoulder, while the client is sitting down, and then they'll get the client to rotate the shoulder one way and the other to bring the qi and blood into the area with the assistance of tiako. So that's one way the old practitioners used to use. 5 shu points are very effective. You know how they work. The Koreans and the Chinese, and Japanese acupuncturists use them a lot. In fact, they only use those. They don't use a lot of local points. Yuan source point. A yuan source point is the energy center of the particular channel. It's usually the third point along the channel, along the yin channels. And that's the one that carries the most qi, and that's the one you may be using to stimulate to increase the qi flow in the channel. Luo connecting point is a great point. If the qi is not moving and there's pain, you can use Luo point. Finger force, breath, angle of depth. So the breath, there's 2 different ways of looking at the breath. If a client is in repletion, you get them to breathe in, and just before they breathe out, you put the needle in. If the client's in depletion, as the client breathes out, completely breathing out, and just before they breathe in, you put the needle in. I would suggest that to make it simple, always put the needle at the end of the out-breath. And you'll find your client is most relaxed in that position and they may not feel any pain. Angle and depth, we talked about running up the channel, down the channel. know your depths to the needle. So when you go through a machocha or the other book that's been suggested for the needles, forgot the name at the moment, look at the needle insertion. Just make sure that you're using 1 chul needles for the wrists and the feet and the face, 1.5 chul needles for anything that has a bit more flesh on them, like the shoulder joint, the back, or the elbows and knees. Re-establishing De Qi. It's not a given, but it's important that if you want to try and move qi and blood or stagnation, you need to manipulate the needle. Lifting and thrusting. The needles need to stay more than 20 minutes, half an hour, you know that. And these are the 5 shu points. I think it's important you need to know those because they're, as you can see, the Hersi and the Zhangfu, they take 60-minute treatment. That's why ACC doesn't want you to disturb the Zhangfu, because it just takes too long, which for me, it's ridiculous, because in the end, what are we here for? We're here to help the client, not to save money. All right, frequency of treatment. 3 times a week if the pain is severe, fair enough. 2 times a week if the problem is severe, fair enough. 1 time a week for long treatment. So you've got 12 treatments. First 3 or 4 weeks, the first 3 weeks, you're going to do 2 treatments a week. Then for the rest, you're going to do 1. The 8 principles. I'm sure you're all familiar with 8 principles. Not if you say, yeah, no. So what is the 8 principles? It's the best way to diagnose. So you've got four aspects, and they have a yin and a yang aspects to them, right? So empty is depletion. So that means there's not enough energy, or well, I won't go too much into the theory, but that's what the depletion means. So when there's depletion, you need to promote the qi and blood circulation. You need to tonify because there's depletion. Tonify of qi. If there's depletion of blood, you nourish. So you're accessing the qi and blood, and the point selection is full, back shu, front move, master points we talked about, and tender points are trigger points. This will help with depletion. Depletion means there's not enough. You need to build it up. You need to boost it. The other depletion aspects is the needling and how we'd put the needles in. So we talked about the thrusting and lifting. 3 thrusts in, 1 thrust up is what I recommend. And you can see the 3 and the 1. The angle of the needle will help to understand, to support the depletion condition. If there's heat, this is the second principle, heat and cold. Hot and cold, the opposites, right? If it's hot, you'll always, it's an acute injury, and there's heat, and you can touch them, and you can feel it. If it's cold, you'll find that there's probably lack of movement. The client will not be able to extend or rotate, and there's pain because cold is quite painful. And to help that, moxibustion or warming and tonifying techniques. So in the cold, full cold, empty cold, I don't think you would need to know that. That's just going into the principles too much. You can look at that up just to save time. And then there's moxibustion. The other principle is external or internal. Is it musculoskeletal or is it zhangfu, internal points? And that will change the way you're going to apply the treatment. If it's external, you're looking for ashi points. If it's internal, you're looking for zhangfu. All right, so the 8 principles are, is it yin, is it yang, or is it blood, or is it qi? Is it external or internal? Is it cold, is it hot? Is it repletion or is it depletion? That's what's going through your mind when you diagnose. If you observe that, then that also gives you the treatment. So for example, if it's a yin deficiency, I'm going to nourish blood. If it's a yang deficiency, I'm going to tonify qi. So does that make sense? If it's cold, I'm going to warm. If it's heat, I'm going to cool. If it's repletion, I'm going to deplete. If it's depletion, I'm going to replete. So once you identify those 8 principles, it really helps with your diagnosis. We only got another 5 minutes, so we're just going to try and keep it down to bare minimal. This is all stuff that you can understand. Don't need to go through that. All right. I think we'll leave it at that, and we'll go through this next time because this is just a generalized slide, which we can do over time. Now you've got 5 minutes to ask me questions, please.
Henry, should we do pain assessment for ACC? Like, 2 out of 10 or stuff like this for ACC officially?
You have a pain chart, right? And you're
Yeah.
going to be asking pain levels, where is it between 1 and 10? And your clients will give you, and I said most clients will say, oh, my pain, if it's acute, my pain's 8. And then you'll say, okay, is it worse with movement or is it better with rest? Is it better with heat or is it better with cold? Or is it worse in the morning? Or is it worse in the afternoon? So then you're going through the levels of pain and where is the most pain. So when you write up ACC, you need to be able to document that. And normally the ACC will also like to see how is it affecting somebody's life? Is the pain disturbing your sleep? How? Is the pain disturbing how you walk? If it's a hip pain, how? And how much? Is the pain disturbing the way you get dressed? So they're very much around loss of quality of life and pain associated with those movements. Anybody else got any questions?
So we're only meeting for 2 hours a week.
2
Not
hours
3.
is not a lot, right? So basically what I would suggest, I'll open up next week. I want you to read the slide, come up with some questions, because I don't want to be sitting here reading stuff you know, and come up with some questions.